Hi, everybody. I'm Farber. I am a pulmonary hypertension doc at Tufts Medical Center in Boston. I'm also the president and the chairman of the board of Team Phenomenal Hope. And in both of those capacities, I would love to invite everybody to come to Boston on December 15th for the first annual Team Phenomenal Hope PH Research Day. So what is it, you ask? It's going to be a day with research presentations, posters, and other presentations of topics that are not usually covered in most symposia or are covered in most registries. So, for example, we will talk about diversity and inclusion in registries and clinical trials. Not only that, but how do we get people who are not usually included in either registries or clinical trials into said registries and clinical trials? We need strategies to diversify our field, because if you look, all of the data so far, and this has actually been published, of PAH registries and clinical trials are overwhelmingly Caucasian. And there's very little representation of any other ethnic groups, et cetera. Other things are unmet needs for patients with pulmonary hypertension. This can be anything from an air conditioner to a way to get a ride to go to a transplant evaluation. These are not covered in most cases by any form of insurance, and they're certainly not covered in any symposia you will ever listen to. Other things we can talk about, which are covered to some degree, but we're going to delve into them, are substance abuse in PAH, especially with the meth epidemic on the West Coast and the cocaine epidemic on the East Coast, and somewhere in between both of them. We're now running into people in Boston who have both. And it turns out, I was reading something very interesting, I believe it was in the New York Times today, that currently in the United States, drug abuse and drug fatalities are the leading cause of death for people under the age of 45, which is frightening if you think about it. We're also going to talk about a hot topic at the moment that probably can't be talked about enough, is what is exactly a disease-modifying agent in PAH? What does it mean? Do we have one? Are we going to have some on the horizon? And if we do, how do they work? And what do we expect from them? And then other things would be clinical trial designs and improving data quality. I mean, obviously, we're dealing with a disease entity in which the number of patients we can recruit is relatively small compared to other diseases. For example, you can do a cardiology trial and get 20,000 patients in a week. We can't get 20,000 patients in the whole history of PAH. So how do we use these patients, especially in the age of presumably sotatercept, to find clinical trials and ways to design clinical trials that will be meaningful and that will add to our drugs or other treatments that will improve the outcome of pulmonary hypertension. So the other parts of this that are important is this symposia is open not only to physicians, but also to ancillary people who are interested in PH, such as nurses, nurse practitioners, respiratory therapists, medical students, fellows, and patients. Especially the unmet need portion, we'd like to have patients involved. Another sort of unique aspect of this symposium is the fact that each one of these subtopics will generate a white paper that hopefully will be published, or at least for sure will be kept as an archive, as a resource for everybody involved, not just the people who were in the symposium, but anybody who wants to have access to them. So this symposium will take place December 15th. It's at the Omni Hotel in the Seaport of Boston, so it's very close to the airport. It's a great location. The other thing of import is the day after the Tufts Symposium, so you can go to both of them. They're both in the same hotel. And if you go to sign up, there are multiple ways to sign up. One is you can go onto the Team Phenomenal Hope website, look under events, and it'll be there. If you sign up for the Tufts Symposium, at the bottom of your registration, there's a link to sign up for the Team Phenomenal Hope Symposium, or you can go directly to www.pah2023.com.